tool for communication for staff member. One of them is known as SBAR. So SBAR stands for Situation, Background, Assessment, and Recommendation. These four key points. And now I will show you an example of what all of this mean. Nurse Corey, give me the situation of patient. Yes, sir. Doctor, the patient currently now is hospitalized due to upper respiratory infection. Respirations are labeled and have increased to 28 breaths per minute within past 30 minutes. See, give me a background check of the patient, please. So, from the register, we have found that the patient is currently 72 years old, female with a history of congestive heart failure and chronic obstructive pulmonary disease. So what is the current assessment for his breathing and vital signs? The current assessment for patient is that the patient breathing has deteriorated in the last 30 minutes. Usual intervention like inhalers, oxygen breathing and treatment have currently been ineffective, doctor. Okay, got it. Now what I want to do, I want you to order the team to consider intubation as fast as possible or immediately and call physician staff or initiate rapid response. This method of situation background assessment and recommendation is used as a way to execute a summary in a very formal report and focus on very relevant and important information. It helps the doctor to not have randomized question that might not in fact be relevant to it and will in fact waste time, I guess. The second is what I call as BAFE protocol. So first of all, it's background, effect, troubles, handling, and empathy. So I'm gonna give you a situation here. So that's the what brings you here. I came here because it seems that I have social anxiety and I've been feeling and I want to fix it, I guess. Okay, tell me, how did you feel when you knew that you have social anxiety, when you feel social anxiety? Basically, how it feels is that you feel like there are eyes around you and you feel like they are judging you, and then you don't dare to speak out or add in some comments when people are talking. And hence, when you don't do that, you get left out from the group most often. See, okay, tell me, what troubles you most of the time? What troubles me most of the time about what I think is that I have low self-esteem. I'm not really that confident in my abilities and skills. I feel like no matter how hard I try, no matter how hard I do, I will still be below average. And I feel like I shouldn't even try because I will just be an embarrassment towards my peers. What about handling? How do you handle it? Currently, I've been handling it by deep breathing exercise. I handle it by shutting out my thoughts, and I try to handle it by being more compassionate with myself by understanding that I have such a problem and that it's okay. Just accept it and remove that thought and try your best to communicate as much as possible to your friends and to have higher self-esteem. Yes, I understand. It must have been very hard to have social anxiety in groups. I understand that you have a hard time communicating even though you want to, and that you are actually interested in talking to people, but because of social anxiety, people view you as introvert, and hence you are less unapproachable. Third one is what I call as a ticket to ride. So ticket to ride is basically a communication tool, a simple communication tool for handling of patient to a transporter to a certain department to get certain tests, maybe. That's one of the examples. So how it happens is that, so a few example, maybe. Hi there. Can you transport Mr. Birkin to the radiology department to get an X-ray? Okay, sure. Yeah, sure. I have a ticket to write sheet right here, and then just fill this up and give it to me, and after that I'll handle it. is basically to tell the patient to tell us back the information that were given to him. We call it as patient teach back. So a demonstration would be, for example, hi, Mr. Birkin. It seems that your dengue fever have been cured, and now we will be discharging you back to your house. So what I need you to know and to do is to make sure to clean your drains, to wear long sleeve pants and shirts if your area has a lot of mosquitoes that might bring harm to your health, and to have mosquito repellent if needed. Now, can you repeat what I said back to me so that I understood that you have understood what I have given, what instruction that I have given to you? You told me to have mosquito. You told me to have mos. You told me to ensure cleanliness of my drain, to have to wear long sleeve shirts and pants, and if needed, to have a mosquito repellent.